All right. I am here. Actually, you know what? Reverend
Chambers.
Annie Chambers. I'm very excited to be here with Annie Chambers. She spoke earlier. We're at the March for Medicare for All. And I'll let you take it away because you say things a lot better than I do. I'm just going to go with that. But what brings you out here specifically today?
Well, because I was basically invited, but I was glad to be invited and to be a part of. I would have come to the march, whether I spoke or not. I would have come to the demonstration because this is very, very important to me. As I said in my speech, I remember, and that child now is almost 60 years old, that we was talking about health care. And we met with Jackie Kennedy and talked about health care. She went back and researched it and found out long before we were talking about health care, there were people talking about universal health care. And so we worked with her, and she went back to her husband, and we had health care was one of the scheduled things that the president, John Kennedy, at that time, had put on to do and was doing. Now, we have met with other legislators, other presidents even, and they have not addressed it fully. Not even the, is some people, oh, Barack Obama. No, that was not health care. That was not health care. We're talking about health care, universal health care for everyone in America, just like they have in some other countries. As I referenced Cuba, because I was there, witnessed it, got some of the health care, and lived it. As a matter of fact, one of the medications I have a heart condition from birth, and I got sick in Cuba. I'm an activist, been an activist now for what, 66 years of my life. And when I got sick and they put me in the hospital, they gave me this medicine that really made me feel so much better and, my heart function. Now here they were talking about pacemakers, stents, capillarizing my heart, all of those things. They didn't talk about that in Cuba, and I have never had it done. But now, I'm going to tell you, the very medicine that Fidel used to get smuggled to me to take is what they got advertising on television now for your heart. You know what that is? Entresto. That is not a new drug. That is a drug that can help a whole lot of people with heart conditions. Okay, because my heart don't pump enough blood to get to my heart, right? Enough blood. That is a remarkable medication. I ain't trying to give them no, because now the pharmacists, but I don't, I got it in Cuba 60 years ago.
And how much did you pay for that?
Zero. I paid nothing. I woke up, I couldn't breathe. They carried me into a medical facility they got there, and they treated me for free. As a matter of fact, I got the best foot treatment in my life in Cuba. Um, you know, so if they can, and America at that time, John Kennedy had put an embargo around America. I mean, Cuba. He had put an embargo around Cuba. Now they didn't, it was hard for them to even get anything. But if they could do that with their people, you understand? And you know what? I was surprised that when I went to Cuba, I didn't see homeless people. You understand? I said, where's the homeless? I've come, there's no homeless, no homeless people. Um, People get the best mental health care and compassion, and you're being treated like you're a human being in Cuba. But they turn the mentally ill out of the hospitals and out of the jails, And if you go to jail in Cuba, it's because you really need to be in jail. I tell some of the people that came that Fidel told America, okay, you want them, here they is, take them. Goodbye, there they go. And they be, I said, oh, hold it, I know you're lying. Because I was there. I used to go back when they didn't even, they said we couldn't go. But we used to go through Canada and roll on over. One time we went in a rowboat, y'all would not believe it, in a motorboat.
You heard it here first, folks.
Right. Along with Michael Ward and us, we was in it. We was in a motorboat and we went to Cuba. So it was.
And what happened when you got there?
Oh, they greeted us. As a matter of fact, Fidel Castro I consider a friend. And black people in America really don't know what Fidel done for them. But I tells them openly, every movement, including Martin's movement, got money from Fidel Castro. Minister Malcolm X and Fidel worked very closely together. I'm a product of Malcolm's. Okay, my brother is brother James X. That was my oldest brother, James X, Malcolm's first lieutenant. Okay? Malcolm could send us to Cuba, but also when the Black Panthers, when we were being attacked by our own government, and I'm the mother of 25 children, y'all. And they thought they was gonna, they used to threaten to take my children all the time. But one thing, we had a code my children knew. Everybody get together, because if they had tried it, my children would have grew up in Cuba. I do have friends in Cuba till today who have raised their families, who have went on and gotten families there. Actually, I did want to go there and live, but I got married and my second husband did not want to go there to live. But Malcolm, Martin, any black movement was in this city, in this country, got aid and support from Fidel Castro. And when we talk about health care, the best doctors in the world. I used to tell the doctor, my foot doctor, the whole time I was in Cuba, I was going to pack him in my suitcase and steal him out. I said, I'm going to bring you back. Get rid of my husband. I'm bringing you back with me. Yeah, but truthfully, America, with their greed, and the way we look at health care, we should look at the people dying. They talking about they got a hold of COVID. That's the biggest lie they ever told. I live in a city where you find homeless people. You find not just homeless people, hospitals full of people trying to get help with COVID. So it has gotten so bad that the hospitals set tents up. So the people can go in the tent so they can see if they got COVID. They don't let them in the hospital. Okay? But John Hopkins had just plain out, at one time, refused to treat people with COVID. Okay? But we fought them. And like I said, when I said, what's going on over there? And one of my grandsons who work at Hopkins, he said, oh, those are people coming to get their shot. I said, yeah, but I pushed this chair in gear, and I rolled on up. I got in the line with the cars. And at first they said, I said, I'm not leaving till you give it to me here, or they'll give it to me in prison. So they gave me the shot. I went back, told all my neighbors, all the community, we going to Hopkins. They got the vaccination medicine over there. So now they saying anybody can get the medicine. What happened when we did they wouldn't give it to us? How many people died before they made the medicine, or the vaccination openly for everybody?
And now we're seeing that in a lot of different countries where,
people just, what happened in other countries now, people dying from It's what happened here in America first.
Yeah.
Because you could not get the vaccination. People, this working class and the poor, did not get the vaccination.
That's really interesting because I think a lot of us thought that, that it was that people could just go ahead and get it. I mean, I work in a homeless shelter, and so it was they literally came and set up shop at the shelter, and we, you know what I mean, we were able to get our things there. It was just made it was made very convenient, and so I think
now,
that's an interesting
but
thing
do
to
you
think
look
about.
how
I
long
didn't
COVID's
realize
been out?
that. Yeah.
Look how long COVID's been out, and how many people died that couldn't get the shot. It used to be, I had people say, I call here, I call there, and they tell me I'm on the list.
Huh.
On the list. But nobody got the shot. And then they made a big thing about, oh, people don't want the shot because they scared, especially black people, all this stuff. I said, don't y'all see all them white people over there in the line? We want the same thing they get.
Right.
Give me that. That's what I told him. I stuck my arm out. The white man had got it for me. I said, give me that shot that white man just got right.
Yeah.
That's what I want. I want the same shot that brother they got. If it ain't gonna kill him, it ain't gonna do nothing to me. You know? Yeah, because that's the lie they put out in our communities. Oh, people don't want the shot because they remember the back there, this and that. I said, oh, no, I tell people, no, everybody needs the shot. Because until we all get it vaccinated, it's going to be here and well. And it's going to kill many more people. I have already lost 5 people to COVID. 5 people. And these were people I put diapers on. People I watched come in the world. It was a good young man, 50-some years old, died from COVID. You understand? So we have to get the word out to people that we need to be vaccinated. We need to get the shot, and they need to stop portraying all the lies. See, because now there's the big fear, because like I said, the Creator always knows. And see, they know that if I ain't well, you ain't well either. You ain't well either. They gave the Indians smallpox and gave us the syphilis, but they got it too. They brought the drugs in our communities and thought it would only hurt the poor and working class people. Okay? And now everybody, now it's an epidemic. At first, it was just them. But see, it don't work like that. It don't work like that. If it hurts one, it's going to hurt all. We all together. So that's why we should fight for universal health care. Health care is a human right. You know, health care for all, everybody. And we got enough vaccine to go all over the world and vaccinate people so that they don't fall dead and get sick. But right here in America, people was dying from COVID because they couldn't get the shot.
Maybe all that money that's going towards Bezos going up to like whatever, not real space, but for 11 minutes could go towards, I don't know, vaccinated people?
You know, do you imagine how many people that would have vaccinated?
That's what I'm saying.
You know how many people that would have saved? Can you imagine? But Donald Trump talked all that BS, okay? But all his little crumb snatchers, as we call them, got the vaccination. All his children got the vaccination. He talks stuff, but he got it also, and his wife got it, and all this. But if it won't that bad, what would you want it for? Once I found old Donald and them, I said, "Oh, is it gonna kill them?" You know. So we got to keep on fighting. That's my reason, my fight. I will fight till I'll fight till they lay me down and cremate me, because that's what I'm going to be done. But I'll fight until then. And that's why it makes me feel good when I see the young people getting in this fight. I said, go ahead. As long my legs may fail me, but he gave me some mechanical legs. And I go all over with these.
And talking about the vaccine, do you know that
made his own.
They have 5 different
Yes,
ones.
yes, yes. I'm telling you
And it's
that
just
we
as effective as the Pfizer.
Pfizer
Even
better than Johnson and Johnson.
Yes.
Cause I ain't gonna trust them because they can't even make baby powder. You look,
They're all good for one thing or another. Like all of the ones who are doing the vaccine.
we gotta go. Okay,
Thank
ladies,
you.
I love
Thank you
y'all.
so
Thank you
much.
so much for your